Kobe Bryant was recently diagnosed with a tibial plateau fracture, and the tibia is the long bone in your lower leg, and it is the connector to your knee, to your femur bone, which is your upper thigh bone. And what he suffered from was a tibial plateau fracture, and from the news it looks like it was the lateral tibial plateau fracture. Kobe Bryant suffered a tibial plateau fracture. This is our tibia, our long bone in our lower leg. It connects to our femur bone, and we have our knee joint. And he suffered what they have reported as a lateral tibial plateau fracture. And this all area is the tibial plateau, and this is where he had his fracture. It's very uncommon for that injury to happen, and so risk factors for just athletes in general, especially our younger athletes, is if a stress fracture or a stress reaction. So in our young athletes, especially our jumpers, our volleyball players, our basketball players, you're jumping, you suddenly have some knee pain, some vague knee pain, you might be at risk for a stress fracture. And what happens when you have a stress fracture in the tibia, you can therefore go on to having a fracture similar to Kobe Bryant if you land on that knee wrong when you're jumping. And so that's why I tell my athletes, if you ever feel like you have knee pain and the knee pain is getting worse and not getting better, especially pain with running, like when you're running your sprints in practice or your ladders in practice, definitely talk to your athletic trainer or come see a sports physician to get that evaluated, because we don't want stress fractures to turn into fractures, especially the tibial plateau fracture. In our older population, they are susceptible to a similar fracture in the tibial plateau because it's just demineralization and poor bone health. So what happens in our older population is that just because our bones tend to demineralize and change as we age, especially in cold weather, if you suddenly slip down the stairs and you land funny on your knee, you are at risk also for a tibial fracture from the same, from just the demineralization and the poor bone health. So also in this cold weather that we're having, please be careful when you're going downstairs, when you're walking on the sidewalks, because it doesn't take much height to cause such a fracture in our older population. And again, if that does happen, we here at the University of Kansas are here to help you and help the athlete in you for our younger population. The treatment for the tibial plateau fracture depends on how much bone has been displaced. So in Kobe Bryant's case, he had minimal displacement, so therefore they're going to do a non-operative approach. They may or may not cast him. He may or not be on crutches for weight-bearing purposes. This is a large bone, so you do a lot of weight-bearing, so he may be on crutches, and that's why his treatment is 6 weeks of conservative management. If there's more displacement of the fracture site, they'll operate and place screws in to help bring the bones closer together to allow for better healing. And sometimes that's what happens, especially in our older population. With the mechanism of injury, they wind up needing screws to help fix that bone site. In our younger patient population, there may be less displacements. They may go with a non-operative approach. So for treatment options, sometimes we do conservative management. If there's been minimal displacement of the fracture piece, you can just do conservative management, which is non-weight bearing, utilizing crutches, potentially casting the patient. Or if there's been further displacement of the bony fracture, we have to do surgery where we'll place screws to reconnect it to the main tibia site.